Oh, hello and welcome to this episode of the Healing Haven podcast. My name is Dr. Colleen Sierra, and today we have the lovely Amber Walker here with us. Before we dive into Amber's story and the subject of chronic illness, let me introduce you to her and have you learn a little bit more about her. Amber Walker is a graduate from the Chicago School of Professional Psychology and is currently obtaining her licensure as an LPC, Licensed Professional Counselor, in the state of Illinois. She received her BA in psychology from Chicago State University and her MA in counseling psychology with a concentration in child and adolescent treatment from the Chicago School of Professional Psychology. Before CCBH, Amber worked closely with children and families residing in underserved populations. Amber provided continuous support and used strength-based and evidence-based models such as the parent as teacher model to strengthen family engagement, family dynamics, and parenting practices in the home. Amber admires working with children, teenagers, adults, and families who are experiencing unique and challenging circumstances. Her professional and personal experiences have provided her with the ability to connect with each individual on a more personalized basis. She utilizes interventions from a CBT and integrative approach, interchangeably applying techniques from a strength-based and family systems model. She strongly believes that our lives are greatly impacted by the stressors that we experience. Therefore, Amber's overall goal is to assist individuals with the ability to identify, process, and formulate coping strategies to navigate through life's stressors successfully. Amber is a vibrant and engaging mom of 3. She promotes her artistic ability to incorporate expressive interventions such as art therapy into her clients' therapeutic space. Her number one mission is to provide clients with a positive therapeutic experience so that they are exiting therapy with a better sense of self and understanding. Welcome, Amber.
That sounds about right.
Oh, good. I'm glad. Sometimes we hear those files and we're like, oh shit, that like is a different version of me.
Yeah.
Well, I just have to share with our audience that, you know, this is not the podcast episode we thought we'd be having. And Amber is going to share a little bit more about that. But essentially, we had a very different thing planned. And then Amber's been really sick. And so we decided, instead of just fighting reality, that we were just going to flow with reality and talk about that instead. So you're welcome, because this is going to be a really real, really honest, super live conversation with tons of vulnerability. So where should we begin, lady?
Well, first, thank you so much for the amazing introduction. As Colleen said, definitely was not prepared to talk about this topic, but I think naturally as a therapist, it has become one of the primary roles and one of the primary experiences that I'm navigating and continue to navigate. But that is chronic illness, and really trying to have it all together with chronic illness, and going through the journey and realizing sometimes you're not going to have it all together. And so that's what we're going to be talking about. I think it's a little bit easier to talk about the unpredictability of chronic illness. I came into this space with the idea, I'm going to be this amazing therapist. Like, I'm going to be there every time my clients need me. All of these things kind of combined in one, and getting to the space of not even thinking about my chronic illness and how that even plays a role in being the perfect therapist. And, I think naturally, some days I feel like I can like conquer the world with my clients. Sometimes I feel like, oh, we got this, like this is going to be so amazing. And then other days, my body kind of reminds me like, no, that's
not today.
That's not what we're doing today. So I think when that reality hit, it was very difficult, because when you're on a mission and you work so hard to get to a space that is so deserving, you don't really think about the things you should have probably considered or increased awareness about until you're actually experiencing it. I think learning to accept the unpredictability of my chronic illness is just the best route that I have to go right now, because it's here. It's a part of my life. It's kind of like my best friend in the worst way. And it is unwelcome.
Enemy.
Sometimes, yes. And so, having the space to be able to be realistic about that, I would have never thought that that would have been an opportunity. And being able to reframe such a drastic experience into an opportunity, that part feels rewarding.
I bet. I would love to back up a little bit. And one of the things I love so much about the Healing Haven and this podcast as an extension of that space is that healthcare providers get to come in here and we get to learn from their expertise and perspective and wisdom and experience. But you also get to be human.
Yeah.
And that's not typically part of a traditional model.
Yeah.
So if it's all right with you and only as much as you're comfortable, I would love to hear a little bit about your journey with your specific chronic illness. Is that okay? Can we start there?
Yes, I think that's perfect, actually.
Okay.
I think, actually, let me start with my diagnosis. The day that I got diagnosed with systemic lupus, this was in 2020, and I remember everyone was going crazy. So many things were going on because COVID-19 was just very prominent at the time. It was very fresh. The world was in a chaotic state.
Yeah.
And so I was one of those individuals that caught COVID, and I was like, okay, like they said nearly everyone's going to catch it, but I didn't really think about it. I'm young. Before finding out about my chronic illness, I've had some health challenges with asthma. I've had some health challenges with always like catching colds and things.
Mm-hmm.
But again, because it has became kind of like a part of my life, I didn't really think anything of it. So then fast forward to me having COVID, my primary care physicians were concerned that my symptoms were kind of like hanging around longer than usual. And I mean, this was me going into like the third month, and I'm like, okay,
holy shit.
am I still testing positive? Why am I still sick? And so we couldn't really figure it out. I was also experiencing some illnesses that isn't very typical of a 30-year-old woman. I had got shingles at the same time that I got COVID. And so,
oh my God.
yes. And so immediately, my primary care physician was like, this is a red flag. Like something's up. We need to do more testing. And then that's how I found out through an ANA panel that I had systemic lupus. And of course, she tested me for a wide range of things. And so in my mind, I was like, okay, I can take this, but I don't want this. And lupus was one of the things where I was like, I just can't do that. I didn't really have a lot of knowledge about it. I just knew like there were some famous people that had it. I knew that my great aunt, she had it. And, I just really didn't know enough about it, but I knew it was something that, the medical community did not take as lightly as the other testing options that was on there.
Can I ask what some of the other options were?
Yeah, they were trying to, the other one was Crohn's, and it was more so because I was experiencing like a lot of gastrointestinal, a lot of like skin rashes, a lot of fevers that would not go away even with medication, Tylenol, Motrin, all of those things. And so they were pretty much testing me for a plethora of things. And my mom, I want to be clear about this part. She's in the medical field. She's an NP. And so she was with me during this whole process. I remember sitting in the office, and she knows my primary care physician because that's also her primary care physician and someone she was practicing under. And so, yeah. And so she immediately started asking my mom about my medical history, a while ago, and like my medical history back when I was younger.
Okay,
And my mom goes, yeah, she was diagnosed with Raynaud's when she was 13.
What's
And
that?
Raynaud's is basically a disorder where if you are touching something that's too cold, if you are outside in the cold, if you are doing anything that requires the cold, the fingertips of your body does not have enough like circulation for.
That's right. They turn like blue and go numb and okay, yeah. Got it.
Yeah. And so when she when my mom told her that, she's like, she's like, okay. And my mom's looking at her, and again, they work together, they know each other, so they're kind of thinking the same thing. And my mom's
right, they were communicating
yeah,
telepathically.
yeah. And my mom goes, you got to do an ANA panel. And I was like, what's that? And she's like, yeah, we need to do an ANA panel. And I was like, what's an ANA panel? And they're like, well, it tests for various, diseases and disorders and things like that. But specifically, we're looking for lupus because it's an autoimmune disease that kind of aligns with some of the symptoms you've been experiencing throughout your whole life. And so I said, okay. Now, here comes the tricky part. I mean, from an emotional standpoint, I have a habit, and I want to talk a little bit about just my role as a single mom and just in general, and having to navigate from a space of, okay, if I tell myself like all of these things, like I can accept anything, like I can accept any news. But I was preparing myself for the other diagnosis. I was like, I know it's not lupus. They would have caught this earlier. Like there's no way we're here now. And so I kind of just left it where it was. And I received a call from her a month later. And I remember her telling me in the office, if we call you, something came back positive. And I was like, okay. She's like, if we don't call you, we have to do further testing and explore what can be the underlying issues. And so I said, okay. And so I remember receiving the call and her telling me like, all of your testing came back so well, but one of them, and she's like, I'm here to talk to you about that. Are you by yourself, or are you sitting somewhere where you can have a conversation? And I'm like,
never want to hear that question from a doctor.
Yeah. Whew. I'm kind of reliving it in the moment. Give me a second. So I kind of, and I want to be clear, at the time, my daughter was only 1. And so, yeah. And so she told me, I need you to take a seat and so I can talk about a few things. And she said, basically, my ANA panel came back lupus. And even though I did not have a lot of information on it, I've heard enough information for me to be petrified about her telling me this. And I didn't really know where to go after that. I just remember calling my mom and her crying because something she didn't disclose to me until we were going through this process was that she kind of always knew. She's like, you were just always sick and like you can never be in the sun. And you were always having breathing issues. And anytime you would get sick with the kids, you would be my baby that would heal months later. And he's like, so I kind of knew it, but I just didn't see enough symptoms to kind of internalize it and take it in and see this as a possible reality. And so it was very difficult. I immediately started to catastrophize about my children big time. And coming from a space of navigating COVID, my kids had to stay with my mom for a month. And that wasn't easy at all. And so just thinking about this, like, oh my God, what is this going to do to my body? Does this mean I only have a few years to live? Like what is this? And then I started to educate myself, but not until a few months after, because I was still going through the very raw emotions of accepting like you have systemic lupus. And so, yeah, that was very complex. And, I took the time to learn about it as much as I can from a holistic approach, a medical approach, but I did not take the time to think about it from a psychological and a mental approach. That was not even something I considered. It's not really something you think of when your doctor tells you, oh, you have systemic lupus. And so
you go into survival mode. And so like, that needs to be done. What do I need to know? Yeah, there's like you feel after, or you feel once you're stable. When you're in it, you fucking survive.
Yes. And keep in mind, that's what I knew best. All I knew was to survive. And I'm not saying that because I want to be clear to anyone who thinks surviving is a healthy way of living. Surviving is not living at all. Surviving is diminishing a lot of what you are, a lot of what you deserve, a lot of the great experiences you can possibly have in life. You miss those things because you're in war mode. And so because you're in war mode, anything that's outside of that, you don't have time for it. It's not something you truly want to entertain. And so, I think it was just another indication of, okay, we've been in survival mode for this long, let's continue to do it, until life kind of caught up with me. And I was like, I can't navigate this like this. Like, I just can't do it. And so, that's a little bit, or a lot of it, of my experience finding out I even had systemic lupus. And finding it out at that time was both rewarding and crippling, I guess. Crippling because the catastrophizing made me feel like my children, feeling like my children were going to grow up without a mom. And I also want to be clear that when I found out that I had lupus, shortly after that, my boys lost their father. And so it was just like all of these things like attacking me from a mental perspective of like, you got to change your diet. You have to do this. You have to get this many hours of sleep. You have to do all of these things to ensure that your children are not left without any parents. And so, that's the space that I was operating from for a while. And I mean, recently. And I found out I had lupus in 2020. And so, yeah.
What a burden to carry.
Yeah. It was extremely difficult.
And still is. I'm sorry, if I would have known we were talking about this, I would have done my own research. So I don't know much about lupus. Can you give us just like a tiny little bit about what it is and how it shows up for you?
Lupus is a chronic illness that can potentially compromise your organs, your mental, um, your entire, what's the word I'm looking for? Your entire immune system, in a sense. To my understanding, we all kind of have these antibodies that goes in war mode when we get like sick, a flu, a cold, pneumonia, whatever that looks like, COVID. We have these antibodies that kind of goes to war, and they fight these viruses and these bacterias. And with lupus, instead of your antibodies fighting the diseases that you get or the illnesses that you get, it attacks you. It's attacking me. So it's like, not only is the illness attacking me, so imagine having a really bad flu that's already kicking my ass, and then the lupus comes in and say, we're going to kick her ass even more. And so it's really
like double team.
It's like double teaming me in a sense. And it's very stressful, because when you're in a space like that, it's like, oh, and going through that constantly, like over and over and over again, it becomes isolating. That's the perfect word I was looking for, because, I'm a therapist. I can pull a million CBT coping strategies out of my ass, a million strength-based approaches out of my ass, but I promise you that the minute I started to experience this, I did not give a fuck about those. I just didn't, because it didn't seem like it was conducive for what I was experiencing at the time. And for a while, I just kind of told myself, like, we're not even going to use those things, even though I knew that would have been the best approach to navigating my chronic illness. I just told myself I wasn't going to use them because it didn't matter. And so, yeah, if just to give a little bit of a brief synopsis of what lupus is, it's specifically a disease that compromises your immune system.
Right.
And there's a lot of changes that you have to make to ensure stress or eating or other external circumstances aren't enhancing the ailments that comes along with lupus. The best example for that is, like, if I am experiencing a stressful moment, the lupus is going to come knocking at the door. Stress is the number one indicator that kind of brings it out. And so when you are navigating a life being a single mom, being a therapist, being a person with so many insecurities, currently working on them as we speak, stress is your best friend. So if stress is your best friend,
right, we've got a problem.
We got a problem. And so, that's just kind of the reality of my circumstances. It's a mixture of my role, who I am, just the reality of my life circumstances and just how that does not align with my overall chronic illness.
Holy shit.
I know. It took a lot getting that out. I don't talk about my chronic illness unless I have to cancel sessions or update my job, things like that. But I don't really get a chance to sit down and just remind myself of what this entire illness even looks like. Like I'm just living in a sense.
Yeah. So I'm so curious, like, right, because it's just your day to day. And
Yeah.
whatever we experience on the day to day, we become desensitized to,
Yeah.
right? And so, like, this is your life. This is just like status quo, normal, whatever. But when you talk through all of that, your diagnostic journey, all the symptoms that led up to that and have intensified and worsened since then, just like the being a single mom in all of it, the fucking pandemic in all of it, like when you talk through all that shit, like what is happening right now once you said that? Like, do you have a moment of like, holy fuck,
Yeah.
how am I still here?
Yes. And I am whew, I am fighting myself trying to not cry, and I know I need to. I know I want to, not I need to. I know I want to show up, as I am. But when me personally, when I have not allowed myself to accept all of the ins and outs of my illness, it kind of like smacks me in the face in a sense. Like I'm putting this all on me, and that's not what I'm essentially trying to do. I think it's just, in real time talking about it, it still doesn't feel real sometimes. Even though I became desensitized to this experience, it's like even saying it, like, you have lupus, you're a single mom, right? You still have to show up for so many things in life. And it's just like, that's my reality. Like nothing's going to change that. So navigate or operating from a space of like, I'm just going to choose not to accept it. And let me be clear, this was me subconsciously choosing not to accept it. I didn't know I wasn't accepting it. I thought I was taking it all in. I thought I was saying like, okay, let's keep going. Let's do this. Let's do that. But I was completely ignoring my need to pause, my need to take a break, because before my diagnosis, that's all I knew. All I knew was Amber has 2 jobs. She's single parenting. She's in school full time. She is living on her own.
Hustle.
Yeah. It's like, nope, it's go time. And so when you're in that space for so long, and you're trying to tell yourself like, I'm not going to let this, take me out, then you go in overdrive even more. And I think that was the reality that set in, that I'm not going to say maybe things wouldn't be as worse if I didn't go in overdrive, but it is one of those things where I wish I can go back and not do it, because essentially it kind of put me in the current state that I'm in now. And that's my lupus flaring up more than ever before. And so now that I know that, now that I'm able to accept it, and I mean like from a radical acceptance perspective, it's like,
say more about that.
Yeah, it's like, in my mind, this is what strength looked like for me this entire time.
The hustle.
Yep, the hustle.
Yeah.
Like, this is what strength is. Like, you're a superwoman. You got this. And the whole time, I think the reality was, you need to redefine strength, because you need to redefine strength, because if your idea is to keep going and not pausing when you need to, and not being kind to yourself when you need to, that's not strength, that's survival.
You bet. Whoa, that is some truth telling.
Yeah.
Right.
Yes. And so, I mean, recently I am redefining strength, and I'm learning that the real power is me saying, I wanted to show up for my clients today. I can't do that because lupus woke up and said it need my time for whatever reason. And I'm saying that in the most sarcastic way. And so understanding that if I'm trying to model to my clients what strength looks like, if I'm trying to encourage them to take time to themselves, why is it that when I think of strength in my own life, those things are not on the list? Those are not characteristics of strength. And so I am currently proactively in a space of redefining strength and learning that it's all about pausing when you need to, because if you don't, things are going to escalate. And pausing does not mean you're not strong. It means that you're being considerate of how important you are, and this is what you need to do.
Oh God, the one-liners coming out of your mouth, Amber. I don't have to make like a million graphics with just some of these things. Damn, that's right.
Yeah. And I'm like tearing up thinking about it because, like I said, I'm still in that space. Like I'm still operating from that space of learning. You know, I've told myself for so long, like, you know, if you, I'm going to speak to work for a second.
Yeah.
I really have to, because I think the hugest example that I want to give right now in terms of needing to redefine my strength is being employed to places that made me feel like when I was sick, I was the issue. And I internalized that so much. I internalized it so much to the point where I could even think about a particular time where I came into work with a 103 fever. And this was me working with kids. And my intentions is never to put children in harm's way. I would never, ever do that. But when you are, again, operating from survival mode, you don't know that you're doing that. You don't realize it until you're in it. And to me, that defined my expertise as a worker, right? As an employee. Like, nope, you got a 103 fever and you're still going in.
That's right.
Now that I think about it, I'm like, what the
like, that's fucking crazy.
Yeah.
And but those are the messages that I think a lot of us of a certain age got. Like that your work ethic should define who you are.
Oh my goodness. Yes.
Right? Yes. And so if you're sick, you show up and you get sent home. You show up so sick that your boss is like, you can't be here. You need to go home. And that's the only way you take a sick day. That was an interesting message.
And let me say this, I didn't even have that opportunity. Unfortunately, I was employed with companies that's like, you got a 103 fever, kiddos can have a movie day today. What? Wow. Just come in, wear a mask, you guys can have a movie day. So a mixture of me thinking like my worth is tied to how much I can do for someone, how much I can show up, with a mixture of, you know, incompatible or selfish and, you know, work environments. That was a bomb ready to explode. It just was. And again, you don't see it when you're in it. You just don't. Because at the time, my mind was telling me you're worthy because you went in with a 103 fever, and you're worthy because even though your body hurt so bad, you were able to go in and deal with 25 kindergartners. And it's just, I can't imagine ever being in that space again. It was horrible. It was surviving. Yeah.
Surviving under colonialism, capitalism, like systematic race, like all the things, right? Because like so many of us aren't looked at as being human. What can you produce? What can you do for me? How can you help me? How can I fucking milk everything you have for my benefit, right? Like that's the systems that we have right now. So of course you were treated like,
I know. Oh, Colleen, I scream sometimes when I reflect. And this is the thing, I reflect often, not because I am upset about my past, not because I'm just realizing like, oh, you were in an unhealthy work environment. What specifically makes me or puts me in the position to reflect about that experience is the fact that I am employed with such an amazing fucking team. I talk about this all the time. I would never forget me being sick and having a lupus flare up about 2 years ago. And my supervisor, I don't know if I can can I disclose her name?
Oh, yeah.
Okay. My supervisor at the time was Petia, and I would never forget her kind of saying like, "You're not taking off," and I was like, "Huh?
Right.
Why
Why
would I?"
you entered into the
Yeah, I
realm
was
of
like, "Why?"
possibility.
Yeah, I was like, "Why would I do that? Like, why? Like, no, I'm good. I can just sit. My body just hurts. I could just take a Tylenol." And she's like, "No, you are completely dismissing your needs. What are you doing?" Um, and she herself started to kind of see the pattern in me where, I did so amazing at communicating, like, "Hey guys, I'm not feeling the best today. Hey guys, I have a 103 fever. Hey guys, my joints feel like they're on fire." And she's like, why are you not messaging us to cancel the sessions? What are you doing? And um I know some people would originally see that as like, wow, like this is amazing. I didn't see it that way at first because I was like, I haven't been taught this. Like, I haven't been taught to take time to myself. I was even overly apologizing, and she kind of called it out, like, "Amber, you don't have to apologize." I was like, "I'm so sorry. Like, I know I'm always sick." And she's like, "Why are you apologizing over something you have no control over?" And in my mind, her saying that, "Why are you apologizing for something you have no control over?" I never thought about that. I never, ever, ever thought about that, right?
It's kind of how we're conditioned, Amber, right? Like,
Yeah.
especially as women, especially as a woman of color, like,
Yes.
you're explicitly told, don't take up too much fucking space.
Yep.
Your existence needs to be apologized for.
Yep. Get up and keep moving through it all. Get up you touched on something so amazing. Being a Black woman. And I didn't even talk about the cognitive distortions I had that were rooted in you're a single mom, so you still need to prove to everyone you can do it. That's including busting your ass and making sure you're perfect at work, making sure your kids have everything they need, making sure you show up 1,000,000,000%, even if you feel like you're dying inside. Like, that was my reality. That was literally my thought process 99.9% of the time until someone said, "No, what are you doing? You are not going to be able to function longevity wise if you continue to go in this direction." And Petty is definitely one of the most impactful individuals in my life because I don't think that if I was employed with CCBH, the most amazing company that I have yet to still believe. I still feel like I'm daydreaming sometimes. I'm like, nah, this isn't real. They can't be this supportive. They can't be this understanding of my illness. I just wasn't used to that. I wasn't. And so, she definitely helped me pave the way for redefining my strength and understanding that I do matter, right? I am important.
Yeah, it's a lot.
I get so emotional talking about that part because telling yourself for 31 years, I'm being honest about my exact age at the time. I'm now 33. Telling myself that for 31 years that I wasn't important and that I have to function in this way, it wasn't easy. It just wasn't easy at all.
For sure. And let me ask you this. Were you actually telling yourself I'm not important versus, and I don't like to present things as a binary, but these are the two things that are coming to me.
I was thinking that as I was saying it, I know what you're going to say.
Yeah, versus you were behaving as
Yep.
though you weren't important because that was
Yep.
the unconscious belief. And the problem is that you weren't aware
Yes.
that was the unconscious belief.
You hit the nail on the head. That's exactly what it was.
Because I fucking relate so much, Amber. You know that. But yeah, that's right. And it usually fucking takes, unfortunately, like life hitting us in the head with a baseball bat.
Yeah.
At least for me, to be like, oh, wait a second, this isn't working.
Yeah.
And it's probably because like I'm doing all the same shit over and over and over again that is from this foundation of unworthiness and unlovability.
Oh,
so I am dancing and juggling and running and people pleasing. And like, what if I just stopped giving a fuck?
yes.
What would happen then?
And the thought of doing that years ago, it's like, oh my God, you are horrible. You are this
That's right.
You know, millions of negative words I can think of
Yep.
right now.
Right. Everyone's going to hate you. You're going to lose everyone. You're going to lose everything.
Oh,
yeah, I know. Me too.
no.
Yeah.
Whew. Have to take a second to breathe.
Yeah. Take it. This is hard stuff and it's heavy stuff. And like, I am feeling so grateful that you were brave enough to come on and do this, because I think this is the shit that we all have.
Yeah.
I think we all think we're unlovable. We're all unworthy. We don't deserve the good things we have. We certainly don't deserve more than what we have. And I think that is the foundation for the hellscape that we're living in.
Yeah.
It just, nobody talks about it because we all feel like I'm so fucked up. And so I have a problem and something's broken about me.
Yeah.
So I should be ashamed and
Yes.
embarrassed about that. So you don't talk about it.
Yeah.
You fucking stuff it and try to do better, which just is like.
And that's what happened. I was so shameful. I was so embarrassed. Like, oh, here you go calling off again. Like, what are your clients going to think? Now you just became, you know, or now you just got to the bottom barrel of being an effective clinician. Like, it's so crazy. Like, now that I am operating in a healthier space and I'm moving away from survival mode, I'm learning like, whew, those thoughts were so irrational that I can't even believe I thought them. I can't even believe I was in that space for so long. And I
all felt so true, right?
Yeah. And the fact that it's not talked about enough, right? Like, I remember watching this TikTok that went viral for some reason. It was a Kim Kardashian saying like, nobody wants to work now. I don't know if you've ever seen that clip, but it raised so many controversy because people started commenting on there, like, the way that you're trying to define work is overkill. I think in the way she was trying to define it, she was saying that work needs to be the primary aspect of life. Like,
hustle culture.
Yeah. So it's like, and so some people were actually, I'm a stickler for like reading the comments, but some people were actually talking about, you know, at what point do we have time to accept the reality of our own individual lives, and that our ability to work is not going to meet the general expectation of what it means to be a working person, right? And so I think a mixture of that put me in the space of thinking, if I need to take time off for myself, whether that's from work, whether that's from even parenting sometimes, that I was just a horrible person, or I was just not deemed worthy enough, should I say. And so I'm very happy that I'm in a space where I'm shifting from that, and that my belief systems do not occupy those cognitive distortions anymore. I'm very fortunate to be in this current space. It's hard. I can barely breathe as we speak, but I'm here. And I have been surrounded around people that allows me to feel like I can just show up like this without thinking about me being a failure, without thinking about me being, you know, this unworthy clinician, unworthy parent. And I try to stop myself every time those thoughts kind of find themselves resurfacing again. And so very happy that I got the opportunity to talk about this today.
Yeah. So I know we are coming up in time, and I know this isn't something we can like wrap up in a bow. I don't even want to fucking wrap it up in a bow. It's messy. Like, that's the point.
Yeah.
And we're speaking from the messy middle, which very few people do. So again, kudos to you. And I'm aware that there are likely going to be people listening right now who are also navigating chronic illness and resonating with so much of what you're talking about.
Yeah.
So is there anything that you can say about what have you done? What are you doing every day? Like, what are you committing to that has got you in a better headspace?
Yeah.
Where you're managing, not in a better way necessarily, but in a different way, and you are feeling the benefits of that.
Well, first and foremost, I think number one is self-compassion. I've learned about self-compassion as a therapist. I work with my clients with self-compassion, but when you are so stuck in this
Mm.
mindset,
Mm-hmm.
you don't even think that self-compassion is something that you need to do.
That's right.
It doesn't, like, the thought doesn't show up. It's like, what? Why am I giving myself grace? And I can't show up for my clients, and I can't show up for like, why would I do that? And the reality is, these things are not in my control. I didn't wake up asking for these things. I'm not purposely putting myself in the situation. So why am I being so hard on myself about this? And so it was really, you know, meeting myself with compassion and surrounding myself around those who I truly felt genuine support, authenticity, love, care. That's not easy, but I'm 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 solidified now. I have the most amazing team. I have the most amazing supporters from a work standpoint, family standpoint, friend standpoint. And, it took some years to get there. It's not
Mhm.
something that we can wake up overnight and just have it. But
Right.
as long as I had those supports to rely on, as long as I had self-compassion, as long as I continued to redefine and reshape my reality for what it was and learn to grow from it instead of hide from it,
Ooh.
yeah, it changed the game for me. It really did. And I also think it's a mixture of checking your circle and making sure that you don't have people in that circle that's hindering or amplifying your cognitive
Damn straight.
reflections about your current circumstances. And that's a whole
Mhm.
other story because,
That really is.
yeah, please believe me, I had some people in that circle like, you're sick again. Dang, you can't make this again. And I'm just like, and at that point, what's funny is like, damn, give me some grace. But I couldn't think of that on my own when it was time for me to give myself grace.
That's right.
Um, and so I think, that's how I got to a space of not surviving, but accepting and loving and reshaping my entire experience. It took those particular things. And like I said, specifically the self compassion, it took me years to get there.
Yeah.
And I don't want to discourage anyone who is seeking the opportunity to utilize self compassion as a way to navigate their challenges, but more so being realistic about the deficiencies you experience when you are operating in a space like that for so long. And
Mm-hmm.
so reminding yourself that I didn't ask for this. I too deserve grace. I too am human, right? And so, yeah.
So it sounds like for you, so much of self-compassion starts and ends with your, at least starts with your
Yes,
thoughts
yes,
and what thoughts you allow, what thoughts you linger on, what thoughts you give attention to. It sounds like
yes,
that's big.
yes. It's all, it's honestly, if I have to be honest, if I have to be um, as raw as I can, a lot of the health challenges that I have, put I'm not going to put all of this the emphasis on me and how I chose to navigate life, but it was really here. It was like my thought. It was like
That
literally like my thoughts were controlling my reality. Um and it took so long to see that. Like you do
mm-hmm.
know your thoughts is what's kind of keeping you in this space. Um and so yes to what you said, absolutely yes. It's a mind thing. And I said earlier, I prepared myself, for a semi-health perspective, physical perspective, but I damn sure did not take into consideration what mental
Yeah.
gain I was going to have to experience to further assist me, with my current illness.
Yeah, for sure. I'm really glad I'm really glad you said that piece because I think it's easy to skew that or for someone to hear that is like, well, then you're saying I'm responsible for my circumstances. And I think what you just explained in such a beautiful way is like holding the multiple truths of like, this is not my fault. I did nothing to bring this on. Like, here I am. It just happened to me. But I'm also not anchoring myself in the story of that because that's a story of victimhood. And is that true? Yes, this shit did just happen to me and I had nothing to do with it. It's not my fault. But if I stay stuck in that story, then I am a victim. So I am choosing to bring my thoughts in a different place
Yeah.
about what I have control over and what is mine to choose and where my autonomy is and where my power is.
Yes.
And it's like, the world is so fucking binary. It's like, it's both.
It is. It is. And honestly, to your point, like, there's so many negative comments about playing victim. I'm putting air quotes on it because I truly don't think, in these kind of circumstances, I don't think anyone is playing victim.
No.
I think they are the victim of what they had no control over.
That's exactly right.
Yeah. And so it's like the only way, or not even the only way, but part of getting to a space of saying I need to meet myself with self-compassion is sometimes saying I have these ailments, is sometimes saying I just can't do this. And it does not mean that I am not a capable or worthy person. It just means that in this particular space, I just can't do this.
That's right. Yeah, it is. It's like we accept reality and we accept ourselves, and in that space,
Yeah.
it creates magic and it creates opportunity, and it just creates this little like gap of like space and time where choice becomes available to
Yeah.
us. But it requires a lot. It's such an intentional process, would you say? Yeah, that's probably like such an understatement.
It is definitely an understatement, but yes, but it's a lot.
It's a
Okay.
lot.
It's a lot. It's a lot. I can literally speak about this for days because there's so many topics to discuss in relation to just navigating life with a chronic illness. It's like so under talked about. It really is.
For sure. Well, we are at time, unfortunately. I could talk to you forever. I love talking to you.
Oh,
I would
same.
I would love to have you back and
Of course.
have a part two.
Of
Uh,
course.
and maybe we actually get to the thing that you had wanted to talk about. So
Yeah, I'm here to stay.
yay. So you'll be back a bunch. We'll talk about a bunch of different things. We'll talk about joy. We'll talk about single parenting.
Yes.
We'll talk more about chronic illness, all that. So stay in touch, folks.
I will. I will stay in touch too because I will be back for sure.
Yeah, so lovely to talk to you. And really, like, thank you from the bottom of my heart. When I pitched this to Amber, I was just like, you're sick, we could cancel, or what if there was this messy middle between like you push through and you do the thing, or you cancel? What if you just showed up? You talked about what's real and what's present, and that's a risk.
Yeah. And let me speak to that, because I really want whoever is watching this to understand that even in that space, I was like, nope, I'm not my best self. I need to schedule this. And when I mean to tell you, Colleen said, show up as you are. Oh my God. I was like, let's do this. We got it. Let's do it. I'm ready.
That's the best, but that takes like so much courage and bravery. I don't have to tell you that, but it takes a lot. So I'm really grateful that you showed up exactly as you are, and we just had a real chat. So
thank you so much, Colleen.
thank you, Amber. We'll see you next time, folks.
All right.